Welcome to yet another session of Rationale to know why and how of a drug in a medical condition. Today, we are going to learn nitrates in angina. Let us dive into a clinical scenario of a 53-year-old male who presented to emergency room with severe chest pain. He describes the pain as crushing pain which appeared after he started climbing stairs, and it still persisted in spite of rest. On physical examination, the patient appears uncomfortable and anxious. An electrocardiogram demonstrates mild ST segment depression in V1 and V2. Cardiac troponin are not elevated, suggestive of unstable angina. Sublingual GTN, that is a nitrate, was prescribed for relieving his chest pain. What is the rationale for using nitrate in this? Angina is a symptom of a coronary artery disease. Angina is defined as substernal chest pain, often described as tightness or heaviness radiating to the left arm, shoulder, and neck. It is caused due to reduced blood flow to the myocardium. Conditions which causes angina are the ones which are associated with the increased cardiac workload, which increases the heart rate and the force of contraction. Conditions like hypertension and aortic stenosis, which increases the afterload, and exercise or a blood transfusion, which can increase the preload. Angina can also be precipitated by conditions which can block the coronary blood vessels, which thereby reduces the blood flow into the myocardium. The conditions like vasospasm, fixed stenosis, and thrombosis will lead to low blood supply to the myocardium. Let us understand the mechanism of action of nitrates. Nitrates gets converted into nitric oxide in the vascular endothelial cells in the presence of an enzyme known as mitochondrial aldehyde dehydrogenase. This nitric oxide will activate an enzyme known as guanine cyclase. Guanine cyclase is required for the conversion of GTP into cyclic GMP. The increase in the cyclic GMP will reduce the intracellular calcium, thereby stimulating the dephosphorylation of myosin light chain, causing the relaxation of vascular smooth muscles, causing vasodilation. Nitrates, being a powerful vasodilator, causes a predominant venodilatory effect, which in turn decreases the venous return, thereby decreasing the preload on the heart. It also has an effect on the arterioles, causing arteriolar dilation, which decreases the total peripheral resistance, thereby decreasing the afterload. It improves the blood flow in the coronary system by redistribution in the collateral vessels. This improves the oxygen supply to the ischemic area. Dose and formulation of nitrates. In acute angina, as in the case which we saw in the beginning of the session, sublingual nitroglycerin is given as 0.3 to 0.5 mg every 5 minutes, maximum of 3 tablets till the pain gets relieved. Patient needs to be monitored for the low blood pressure as the drug can cause hypotension. For the prophylactic use, the patient can be prescribed oral tablet prior to any kind of exertion. For example, 30 minutes before the exercise. Transdermal patches are available these days, which works for good 24 hours. Thank you for watching this video. Follow Rationale for more such videos. Please like, share, and subscribe. Thank you once again.